$2.6 billion.
In the 2023 financial year, diabetes costs the health system $2.62 billion.
And only a small percentage of that money goes towards prevention. It is an absolute disgrace. No one's talking about it.
Yep.
It's like they're just sweeping it away under the carpet so you don't know. 1 in 3 New Zealanders are overweight. 50% of Māori adults are overweight. 50% of Pacifica adults are overweight. Now, if you go into any deprived area, the stat you know is far worse than that. I got a chance to sit down and have a conversation with Dr. Ryan Paul, who is a diabetes specialist, a doctor who sees firsthand the effects of diabetes. It's all about ambulances at the bottom of the cliff.
Yeah, it is. It's very true for our health system in general.
These stats and what he says is going to shock you. Diabetes, obesity, and all of these health-related issues that are affecting so many of us. This is not just a Māori and Pacific problem. This is a New Zealand problem. As Dr. Ryan Paul says, it's only getting worse. So don't forget to like, comment, and share. This conversation must be heard far and wide. Dr. Ryan Paul, enjoy. Before we get started, Unfiltered with David Atelier is proudly part of the Acast network and produced by the amazing team at Fanaticals. This episode is brought to you by my good friends, Trust Motors. Now, they're an amazing company that support everything we do in the community. I've known them for a long time, so if you're looking for a new car, trading in your car, whatever the case may be sure to support those who support the community. Trust Motors, how car buying should be. Dr. Ryan Paul, thank you so much for joining me, brother. How's it going?
Yeah, good. Thanks, Dave. Thanks for having me.
That's all good, man. You're a man of many hats, you said earlier. So talk to us about some of those hats.
Yeah, no, I'm a diabetes doctor based down in Kōrero, Hamilton. Also co-chair of Māori Matahuka, which is our national diabetes network, and do a bit of research up at the University of Waikato as well on diabetes. So really keen for us to do something in this space.
Mahitahi, is that the same as Mahitahi Haora, or is it different?
Different in terms of we're a distinct network.
Yep.
But it's very much that teamwork, bring communities together to try and fight diabetes.
How bad, when we were talking earlier about some of the stats, but how bad is it?
We know that diabetes is increasing in prevalence. We know how much it affects our Māori and Pacific whānau more. We're talking about getting up towards 10% of our Māori and Pacific whānau. And I think we just have to stop accepting it being normal, that people are dying in their 30s, 40s and 50s. We need to draw a line in the sand and say, look, we can do better in this space, and what can we do as a nation to really improve that?
And Māori Pacifica, is that predominantly type 2 diabetes?
It is, yes, so it is. So much more so for type 2 diabetes. Type 1 diabetes was thought as a Pākehā disease, but even then we know that about a quarter of people now diagnosed with type 1 diabetes in Aotearoa are actually Māori and Pacific and Asian ethnicity. So it's actually trying to break that stigma that it's just not a Pākehā disease for type 1 diabetes. It's just not a Māori and Pacific disease. It's not stigmatising that for type 2 diabetes, but it is a lot more prevalent in those communities.
Yeah, I mean, we talk about stop normalising it because we especially in Māori Pacifica, we work with a lot of Pacifica and Māori, and it's almost like when you get gout, you laugh about it. How can we change this?
I'd love it to start at the top in terms of how can we, as our leaders, of our churches, marae, other communities, get together and say, what can we do together and try and support that, obviously, at every level we can of the health system. I think initiatives that you're doing, absolutely fantastic. There are other great initiatives out there, Kimiora, Manatū, other ones in different districts. It's about how we can support those, but I think actually looking at what we do as a society in terms of healthy living. We know obesity is a big driver of that, and 1 in 3 New Zealanders or New Zealand adults are now obese, and that's actually almost half of Māori and just over half of Pacific peoples. So it's a really big problem that we have to face and start discussing seriously as a country.
These are massive issues, eh?
Yeah, they are.
You think like, what are you saying? 1 in 3 New Zealand adults are obese, 50% Māori, adults are obese, 50% Pacifica.
Essentially.
But, if you walk around any deprived area, it's far worse than those stats.
Oh, it is. And that's a really key point, Dave, is that we know that diabetes and obesity it really affects those who are socioeconomically challenged or deprived. And it's breaking that stigma. It's not people's fault. Just for example, like genetics. So roughly about 50 to 70% of obesity is thought to be due to genetics. You chuck in the deprivation, the effects of colonisation, the cost of living at the moment, and even things like that people don't think about, like sleep deprivation. We know people are doing shift work. We know they're at much greater risk of diabetes and obesity. It's how about we can start tackling those issues so we can do something about it.
But how can we, in terms of judgment, and the way people will think when they hear you say that these are all facts.
Yeah.
But then people say, "Oh, that's just all excuses."
No, they're not excuses, and I think that stigma's right throughout society. It's even right throughout healthcare professionals, and it's something we need to stop and try and combat. I think getting the message out there, like podcasts like this, is really important. Our bodies will defend weight, so if people do go on diets, typically they'll lose weight in the short term, but then they'll just, and what happens with the body, it produces more hormones to increase your appetite. It actually reduces how much energy you expend even when you're doing exercise. So often your weight goes back to normal, which is why we need interventions to try and break that cycle.
So your body defends weight?
Yeah, it does.
I've never heard that.
Yeah, no, it's very good at doing it, which is why I guess so many diets fail in a way, and why we need, I guess, intervention programs that have been shown to work as being a start. It's like having a platter of options and doing what suits people best. And it's going to be different for every individual. It's going to be different for every community. We think that, we're not going to get out of this issue just by bariatric surgery or medications like Wegovy to help with weight. They're very important tools in the armoury, particularly for people that have significant obesity. But this is actually much bigger. We need a population-wide approach, and thinking about things like community-based programs that we know work. There are resources out there that actually show how you can, healthy living, people think it's expensive, but there are actually ways you can do it more cheaply than what most families and whānau are spending on food. So it's how we can get those messages out to try and improve where we are at the moment.
Yeah, when I started my journey, I was at 210 kilos.
Yep.
I didn't even know if I was pre-diabetic. I never checked. It's crazy when we have people come in to do our program. We measure them. They're pre-diabetic. They never know. Yeah. Borderline having a stroke. They wouldn't even know. But when I started, I had zero money, but I was educated through my sports background, right, of how to make the best choices that were available to me. I was living in a community home, and meals would get delivered to us, and I just choose to eat what I knew was good for me.
Yep.
But what I understood was not everyone had that education.
Yeah, and it's a very good point, Dave. Like I think as a country, our health literacy or understanding of health perhaps isn't as great as it should be.
Yeah.
Even people thinking like, I drink 3 litres of fruit juice a day, that's healthy. Well, actually, there's a lot of calories, there's a lot of sugar in terms of putting up your glucose levels.
Yeah, just on that, around education, around health. And I live with a guy called Hemi at this community home. And I was training hard, training the house down. And he thought he'd make me like a post-training meal.
Yeah. And
he brings it, I said, "Here, Dave, I made this meal for you." It was a fruit salad and a tub of ice cream. And he thought that was healthy. And again, it's just all comes back to the education around and people take that for granted. They just think everyone knows.
Yeah, they do.
But not everyone knows. And now with the cost of living and how everyone's so busy just trying to survive, there's no knowledge being passed down to the children. So you've got this whole generation that just don't know nothing.
Yep. And I think it's about how we can turn that around and empower whānau to actually have that knowledge so they can use that to build on. And I think it's really important for people to realise that you can reverse diabetes. More than that, you can prevent it. And I think that's what we should be aiming for. So if you have even pre-diabetes, diabetes, if you're sort of been told or diagnosed within 6 years, there's actually a very good chance that you can reverse it. And it is about, the big part of that is weight loss. And it's just so people are aware, you don't have to get down to 70, 80 kilograms. You know, that's what society tells you what to do. In terms of your health, if you're able to even lose 5% of your body weight, that can have a big improvement in everything. 10%, you get into reversal. So what that means, if you weigh 150 kilograms, so, you know, lighter than what you were, if you can get down to 135 kilograms, that's actually, we're looking at, can we get into your diabetes into remission? And, you know, you may get told, when you get told, oh, I've got to exercise, you might think, oh, that means I've got to go for a run around the block. I need to run marathons. No, it doesn't.
Yeah.
We can start off by walking to the letterbox, walking around the block. You can do housework. You know, you get into your vacuuming, mowing the lawns. That's good activity. Build your way up. I think, you know, from the couch is you know, what your program is. It's how it doesn't have to be putting your shoes on and running a marathon from day one. Even if you've got diabetes, even stretching will improve your glucose levels. Yeah, it opens those muscles up. It gets that glucose into the muscles. And that can lower your glucose levels without doing anything else. So yoga, Pilates, that's actually quite effective at reducing your glucose levels.
Oh man, I'd rather run a marathon than do yoga.
Yeah, I would too. But just
I went into yoga one time when I was playing league. This arrogant league player, Walson, top off, you know, and laugh. This will be easy. And I was sweating bricks. Yeah. It was Bikram yoga. Typical me. I chose the advanced class.
Oh, foolish.
Man, I was sweating bricks. Like this, I felt like I was dying. And people enjoy that shit.
Yeah, exactly. I don't know why, but it shows how different exercise can affect you in different ways.
Yeah.
And find what works for you.
Yeah.
It does. It's not one size fits all for everyone in this space. And
I think the important thing you said there is just starting. And we always see it like when people start challenges, right?
Yep.
You talk about the weight loss. People start challenges. They be super strict. Everything they do on social media is #healthy living. They eat like they got a live-in chef, train like they're a professional athlete, but they can't maintain it. As soon as the challenge is over, they have a big piss up and they're back to normal.
Yeah.
And then they feel crap. This is the cycle. They feel crap about it. Oh man, I've got to start again. So they lost 10 kilos on the challenge, fell off the wagon, put on 15. So they start again, lose another 10 kilos, and it's just that same. They're losing the same 10 kilos, but putting on an extra 5 every time. It's about just building that solid foundation that you can just maintain for the rest of your life. It's not about having a six-pack. It's about being healthy and happy.
No, exactly. Very good points, Dave. And part of that is also realising that obesity is a chronic relapsing disease. So it is a disease across the lifetime, but you can break that cycle. So even if you have bariatric surgery, which I know many whānau are going to Turkey and Mexico for, or even if you go on medications like Wegovy, unless you actually get that healthy living change, it's actually you're going to go back to square one. So it's why it's so important. What can you do that's sustainable?
I was over in Turkey.
Yeah.
And my hotel was like a hospital ward.
Yeah.
And people with bandages around their head walking everywhere.
It's crazy, isn't it?
And then, what was worse is my missus is saying, maybe you should come here.
Yeah.
My hair's not that bad.
No.
When it's that time, I'm just shaving it off. If The Rock can shave his hair off, so
could I. Yeah. No, good on you. But on that, I think it's just realising, what can we do that is sustainable? It's so much easier doing it as a group. And whether it's your whānau or direct family, it might be your work colleagues, it might be a wider community and a community-based program. It's just is often so much easier if everyone's doing it.
That's why we do. I mean, I love training in groups. I love suffering with others.
Yep.
And there's a joy in it. Like it's the camaraderie. We don't go to the pub. We go and train together and go and have a protein shake after. I think that's the benefit of doing it all together.
Oh, it is. And one thing we really haven't spoken about yet is about the mental health benefits as well. That's a big thing. Actually, exercise should be fun. And that's why many of us, we do social sport. It doesn't have to be elite sport.
Yeah.
Whatever we do, it's, if we can just improve our overall life, it has to be a big positive.
The bariatric surgery, and people think I'm against the surgery. I'm not. I just think it should be the last option. If you've tried everything else, or if you're at such an extreme weight that you just must, and they're going to give you OptiFast to get you down to a certain point so you can get the operation. Why, there was the government set up, not even this, it was the last government set up they called an obesity clinic. You heard of that?
Yeah.
Where they give people OptiFast to get them skinny enough to qualify for the operation. It doesn't mean they'll get it funded or that they can pay for it. And it annoys me because of the difference in the funding they get compared to community programs. Why is it, do you think, that any government, they always look at things from the top down? They never understand that we've actually got to fund from the ground up.
I think that's been a problem ever since I can tell you from diabetes point of view, since the 1980s, our action plans have always said about the importance of, those community-based programs, and it's largely been ignored, never been implemented. And now we're in the position that we're in, particularly with such big disparities for Māori and Pacific. I will say, just back to your point about the obesity clinic, I think that actually really has an important role. But one big sad part is that people haven't had any option up until then in terms of doing something, about a targeted intervention for their weight or their overall health. So it's how can we think about like a tiered approach in many ways. Here's what we're aiming for large part of a community. These are people that do need extra help, and that may be with OptiFast. These are people that need even more help, and that may be with Wegovy.
Yeah.
And then we've got bariatric surgery at the end. But we can't use just an obesity clinic as the whole solution.
Yeah, I think the whole thing, whether it's Wegovy, obesity clinic, whatever it is, they all need to be done alongside a community program, a healthy lifestyle program, because like you said, all those things don't change where you live. They don't help your family. They don't change. They don't stop your family eating crap, and they don't change up here.
Yeah, and you're right, and that's where we need that. I'll be honest, it's that altogether whole community approach.
Yeah.
And one thing we're very keen to develop is actually an obesity task force for the country to take this further. Look at what's working, look at what's not working.
An obesity task force.
Yeah, I think that's what we need. I think as a country, we need to start seriously addressing some of the issues we have in terms of not being healthy.
It would be good to have a task force. Can I be like superintendent?
I was actually going to talk to you about that today, Dave, but I might talk about it offline.
I'll be the commissioner.
But I think, like, with people like you coming, Dave, I think it's really, really important is actually getting that message out to our communities.
Yeah, but the thing is that we get all these, we've done these things before, the fucking government don't care. Unless we get them on board, so unless whatever government is, so I'm all for this task force, but unless we have buy-in from the government, it's just a waste of money.
No, in many ways, you're absolutely right. And it's how, I'll be honest, that the last election in Australia was one on health, and I can see it potentially being an issue here. How can we actually start thinking seriously about health?
Well, we have to. Like those stats, so talk to us about the cost. Like, just for the list, like if we don't get a grasp on this is the real epidemic right here.
It is, yep.
Talk to us about those costs. What's it costing?
I can talk specifically about diabetes.
Yeah.
It's been the first cab off the rank. So in the 2023 financial year, so diabetes costs the health system $2.62 billion.
Billion.
So massive amounts. And only 48 million of that, so less than 1.8% actually went on diabetes care. So the rest of that is actually going mainly on dialysis and transplants for kidney disease. It's going on their heart bypass and stents. It's going on the amputations for their foot disease. We need to break that cycle, particularly since we know, for effective community-based programs, that we basically every dollar invested saves about at least $10 to $20 downstream, if not a lot more. And it's how we can actually start approaching this as we know, look, it's a really big issue, but we're going to be saving our country money in the long term. We need to start doing that now to try and address those issues.
It's just nuts, hey? When you hear those figures, it's nuts. And the thing is that that's why it's good we're doing this, and we'll keep doing stuff like this, is because no one's talking about it.
Yep.
It's like they're just sweeping it away under the carpet so you don't know. Because if people, the more people that find out, they'll be like, what? And so less than 2% is used on what were you talking about? Lessons
Well, basically, on actually caring for
on
people
caring,
with diabetes
and
before
then,
they get to
and
complications.
then even less would be on prevention
Yep,
programs.
exactly.
So it's just crazy to me.
Yeah.
So again, it's all about ambulances at the bottom of the cliff.
Yeah, it is. It's very true for our health system in general. It works well if people basically end-stage illness or, very unwell. But in terms of actually looking after people's health or hora, it's not doing a good
I
job.
mean, we're not talking about taking this stuff away.
No.
I mean, of course, we've got to still be there.
Yeah.
But let's stem the flow.
Yeah.
Let's, I always say to these bureaucrats, have we ever thought about investing in a fence before the cliff?
And that's what I think we need to start doing. I think it's been a reflection of basically every government as really struggled with this. But I think it's about I'd love actually every party to start thinking we need to join up and do something about this. Otherwise, we're going to be in real trouble.
Well, that's what we need. We need cross-party support that's going to agree to a long-term plan for this, right? Because it's not going to just change overnight. It's not going to change in 3 years.
We're not going to turn 150, 200 years around overnight. So it's going to be, it's going to be a big journey, but it's something we need to be brave to do.
Is there anything that can be done, like, in these swamps, these fast food swamps that we live in, and all these deprived areas that we work in? Is there any kind of regulation that we can implement, or the government can implement this? I mean, you drive anywhere, there's the vape, alcohol, TAB, and a bakery, fast food chains. They're everywhere. In Māngere, there's a KFC. They're within like a couple of 100 metres. There's two of them, on the same road, a couple 100 metres away.
And it's a big, I'll be honest, it's a big part of the problem. We live in but purely a obesogenic environment. It's all there. And we do need a lot more, I'll be honest, high-level population approach to health. So we've been very good at supporting public health. When we had a pandemic like COVID, we heard the public health voice. As soon as it's not like that, obesity and diabetes, that public health voice just gets completely ignored. How can we actually think about that? And that comes back to that whole community, whole country approach to start making our environment healthy for our people.
Do you think that, for me it seems, it's not even just Māori Pacifica, like anyone poor.
Yep.
Because this doesn't discriminate.
No, it doesn't.
But poverty plays such a big role. Do you think that in these neighbourhoods that we're being targeted by these chains of fast food and alcohol and all these types of things, and that it's just being allowed to happen?
I can't speak specifically to that, Dave, but if you just look at the facts that they're more prevalent in poor communities, that you have to say that is the case.
I always think just follow the money. Like, who's making all the money here?
Yeah,
it's companies, and none of it's being reinvested into into these neighbourhoods that they're having the most harm.
And it is causing harm. And you're right. It doesn't discriminate. Obesity and diabetes, for example, it's a disease of those who are deprived. And it just happens to be, Māori and Pacific are much more deprived than other peoples. But we know, for example, our Indian communities, they have much greater rates. And so it's about, how can we do that? And I think you're right. We actually have to start having a serious look at how those commercial areas are structured.
Yeah. Well, I mean, it has to happen. And when you hear those stats, and I think the more people that hear that, and it can become an actual an issue in the next election. I think that's what we need to push for.
And why is it cheaper to drink fizzy drinks than water? If you go on, it's about how we can, or even just start getting that awareness out there to empower people. But how can we start getting that big level change that we need?
Yeah. And like you said earlier, we've helped many people reverse type 2 diabetes, so it is possible. What do you say to someone that has type 2 now, is down in the dumps and feeling like, man, this is the rest of my life?
Yeah, I think lots of people feel like that. They think, shit, I've got type 2 diabetes, that's my life sentence. And it's trying to actually correct that mindset. It's trying to put people in touch with the best way, the best solution for them, and it is about individualising that. It's a real crime that we don't have like a national diabetes remission program that's funded, which to me is nuts and something we are trying to address. But how can we actually create those pathways to empower people to actually get their diabetes into remission? Big part of that as well is actually knowing that we have really good medications and tools out there that can help people on their journey with diabetes. We struggle, I'll be honest, we don't have full access to the best medications for our whānau with type 2 diabetes, despite knowing that for some high-risk groups that it can be funded. That funding would actually be cost-saving to the health system long-term. That's not Pharmac's fault. That's just that, once again, these institutional barriers that we have. How can we break down those institutional barriers to start coming out with solutions? So it's about supporting whānau. It's actually about supporting their community team. It's about supporting their healthcare team. How can we basically get, open up the solutions, break down the barriers to get people working?
Yeah.
So we were great. We had a big celebration last year. It was for our whānau with type 1 diabetes, which is roughly about 25,000 people. We got funding for continuous glucose monitoring and CGM and insulin pumps.
We use Dexcom at PBM.
So I mean that's actually the best access in the world. That's something we should be really celebrating. Now we need to work on getting funding for CGM for our whānau with type 2 diabetes, and it's not going to be everyone to start off with, but it's actually about how can we target that to the right people and use that as a really powerful tool.
Yeah. Can you explain? So we use Dexcom.
Yep.
Can you explain what that is and how it helps the user?
Yeah. So what it is, it's wearing a sensor, and it's only probably the size of a $2 coin, most of them, and you can usually people wear on their arm or their tummy, and that can send glucose levels every 5 minutes to your phone. Most people use their phone. We can use a reader, so you can see basically any time what your glucose levels are. What I get people to do when they're wearing it is to experiment. I say, try different types of kai, go for a walk, take your medications, see what happens to your glucose levels, and actually seeing that positive reinforcement of seeing those changes, and actually seeing what does affect your glucose levels, I can think can be a really powerful message for people.
Because it's instant.
Instant, yep. And you can know that you get that feedback right away.
Because ours also gets sent to the GP, which is amazing.
Yeah. It's changed the way we work. Because we can, in our offices, we can log in, we can see what's happening, we can text, phone, email. It doesn't mean people have to come to the practice.
Yeah.
So it's breaking down more barriers, which we have to do.
But the problem is, like you said, for type 2, which is the people that we're working with, it's not funded.
No, it's not funded. And we've got roughly about over 300,000 New Zealanders in that boat. It's not a small number.
And like you've said, if these things are funded, it's actually a cost saving in the long term.
I will say for type 2 diabetes, it's just some groups.
Yeah.
For example, we know that for Māori and Pacific on insulin, or other high risk populations, that we can be cost saving in the long term.
Yeah.
But I'll be honest, I don't think the country can afford to fund everyone with type 2 diabetes.
What about just BBM's group?
Well, yeah, that'd be a great start.
Fuck, we get no funding anyway,
Yeah.
so it's coming out of my pocket.
Yeah, but you're right. It's about those things which work. How can we support those into those programs to actually start turning the tide on diabetes?
I think it needs to be. They need for groups like us that are working, not just us. There's plenty of groups working.
Yep.
We're probably the biggest with the highest profile, with the most research to back us up, but. That way, like you're saying, even we can just see what's working, and then we can scale it everywhere.
Yep, support what's working.
And but with the glucose levels, can you explain it? Because to be honest, I'm sitting in a lot of these hui's, and I haven't had my coffee.
That's right.
And I'm like, yep, and I haven't taken it in. Can you tell me where our glucose levels should be, and where they are for type 2 diabetics, and we're trying to get it to?
Yeah, so with and I'll be honest, CGM, or that continuous glucose monitoring, has really changed the way we think about our glucose levels. So we're roughly aiming for our glucose levels to be between 4 to 10, at least 70% of the day. So that's what we're aiming for, and ideally 0% below range, but only for people on insulin and sulfonylureas. So there are types of medications that people use for diabetes. It's just so people know if they're on any other medication apart from insulin or glycoside or glipizide, they're not going to go low. In terms of they're not going to reach any danger from their glucose levels going below range. That's really important. I still see lots of people who are eating because they think, having snacks throughout the day. So, I've got to eat. My glucose levels are going to go low. That's not true at all. To be honest, that's just going to make you put on weight, which is what most people don't need. So it's only if you're on insulin or the glipizide or glycoside that you need to worry about your glucose levels going less than 4. The other way I turn it around is, we're aiming for greater than 70%, in range, so to speak. It's okay for 30% of the time for your glucose levels to be above range.
Yeah.
You don't have to be perfect. Your glucose levels will go up and down throughout the day. You never get a flat line. I've worn plenty of sensors. I'm lucky enough not to have diabetes. I'll be honest, no matter what I eat for breakfast, I go into double figures after eating breakfast. For some reason, scones, jam, and cream actually gave me the lowest rise. I can't tell you why.
Well, that's a good thing.
Yeah, that's a good thing. Not that I've changed to that every day, but it's just to let you know that you have your glucose levels go up. That's completely normal.
Yeah.
But we're just aiming for greater than 70%. Time in range. For most people don't have CGM. We go by HbA1c, which is basically a blood test that tells us our average glucose levels over the last 3 months. And for most people, we're aiming for HbA1c less than 53. That's where we would love to be. Now, there's plenty of whānau that get the HbA1c measure that never know the results or know what the results mean. And it's about, once again, how can we empower whānau to know what it means and what can be done.
Yeah.
It's also knowing as a health system, realistically, people with diabetes, their contact with the health system is less than 0.1% of their lives. The rest of the time, they're out there living. They're doing the real mahi. How can we actually get people to change in between appointments?
Yeah.
How can we support them do that? So it's basically every level, Dave, that we how can we support people to make changes?
How do people, if someone's there watching this and they haven't
Yep.
gone to a lot of the people that we work with don't have GPs.
Yeah.
Is there any signs that they should look for, the way they're feeling, where they should think, oh, shivers, I better go get tested, see if I am a pre-diabetic or whatever it is?
Yeah, so a lot of the time you can have no symptoms. So that's part of the issue. So we know how much of our our GPs are under the pump. But the symptoms of having a diabetes, if you feel like crap, just really tired, you're losing weight even though you're not trying to lose weight, you're peeing lots, you're drinking lots, you may be getting frequent skin or urine infections, there'll be big warning signs that, hey, I might have diabetes. And I really encourage people to get checked because it's one of those things that the sooner we know about it, the more that we can do. It gives us a greater chance of remission, which is what we should be aiming for. Once you have diabetes long term, what does happen is, for actually reasons we still don't know, but those little cells in your pancreas which produce insulin are killed off by your body. And so that's why if you have diabetes long enough, many people will need insulin. And insulin is what can potentially cause those low glucose levels. There's still a big stigma out there in the community where once I've got insulin, I'm going to die. That's not true. Insulin's still a really, really good medication. But what's great if we can do is get to a stage where we don't actually need insulin. That should be our aim. There's also I'll be honest, there's a lot of crap out there on social media. There is, and that's about a whole lot of stuff. It's about stuff that metformin causes cancer or dementia or statins do that. And there's all these diets, carnivore diets, the way to go. There are all these new apps where you just put your finger on your phone and it tells you what your glucose level is. To be honest, most of that is all lies.
Yeah.
If you're ever in doubt about, what is real and what's not, I think there is a time to talk to your healthcare team. It may not be getting a GP appointment. It may be a nurse at your practice. It may be your pharmacist or your chemist or someone else that you trust. How can we actually look at that? And one thing we're trying to do to address that is how can we get that community leadership in place so we can get trusted members of the community who've actually done some training or credentialing for another term in diabetes and health, just so there are people that they can go to ask these sorts of questions, because we know how much strain is on the rest of the health system and how hard it is to get into GP. The other part of GP is that we know that many people can't afford to go.
Yeah, you can't afford to go, or
About at least 1 in 4 New Zealanders. Yeah. So it's about, how can we get that systems change? How can we help our communities to basically be empowered to change? It's hard, but we can't stop fighting. We can't say no.
It's hard, but it must happen.
It has to happen.
What's the dream, bro? Where would you love to see us as a nation be?
I'd love us to be healthy. I'd love us to basically have no type 2 diabetes. That would be the dream. I'd love to be out of a job. But even if people do get diabetes, which I think we have to be realistic, but we can keep them well so they don't get complications of diabetes. I'd love to see no one on, dialysis from their diabetes, no one losing their feet, basically people living well, people being, alive to live and, play with their grandchildren. We need to stop our people dying young and keep them well. I'll be honest, my dream would be to keep them dying from cancer and other causes, to die from dementia, get a big prostate, get other problems that old people get, not just dying young from diabetes. And yeah, that'd be my dream. How can we turn that around and empower people to be kings and queens of their own health, rather than the current issues that we have at the moment?
Yeah, man, that's the dream. Last question I ask everyone who comes on. What's your why? Why are you doing this? What keeps you going? What keeps you banging your head against the wall when the government's not listening? What keeps you going?
I see the real world every day, what is happening. And it's a bit like tub thumping. I get knocked down, but I get up again.
Yeah.
And
I get knocked down, but I get up again.
Exactly. Yeah. But you have to.
I thought you were going to join in there.
No, my singing's not great. Trust me. But I think that is the why.
Yeah.
Because we see it every day, and it's sad, and it's about I think actually standing up together and saying we're not going to put up with this any longer. This is something we need to do and unite against it.
Yeah, man. The people. That's what it's about.
It is.
And brother, we've got to unite and keep going, and put me on that task force, and I'll rule with an iron fist.
Yeah, it would be great to have it. We need inspirational people like you to drive it.
Yeah, well,
and
when you see, like you're saying, when you see the effects,
yep,
you see people with chopped off limb. You go walk around Middlemore, and you see the people dying far too young, and that's what it's a disgrace.
It is a disgrace,
and something needs to happen. So let's do it, man.
And if people don't believe that it's great, you go for a walk around Middlemore, you see what's happening, you'll see the real world, and no, this is real. We have to do something about it now.
Yeah. Thank you for joining me, bro.
Thanks for having me. It's awesome.
If you made it this far, thank you so much for the support. It really does mean so much to us. Don't forget to like, share, subscribe, and comment on our videos, and share this out. These stories are so inspiring, and they need to be heard by everyone. Thank you so much, team.